Hello and welcome to Ask Your Doctor. This is an informative health session that is sponsored by My American Doctor. We are a group of highly trained and experienced doctors, and we represent all specialties and provide second opinions throughout the country. We are not here to give individual health advice or treatment plans, but we are just here to kind of offer a generalized idea of certain conditions and give you guys some more information. If you still have questions or need any further clarification, you can get in touch with us. Today, we have the pleasure of speaking with Dr. Sridhar Guduri. Hi, thanks for being here today.
Morning.
How are you doing?
Good, how are you?
Good, thank you. Well, today I'd like to understand a little bit more about allergies, asthma, atopic dermatitis, and hives, both in general and how they might affect daily life. Can we start broadly and then get into more kind of specific situations today?
Sure.
Awesome.
Morning, good afternoon, good evening, wherever you are. As Ariana said, my name is Sridhar Guduri. I'm an allergist in a single specialty group practice here in Columbus, Ohio for more than 20 years. It's a pleasure to meet you all in this live setting. This is a first for me, so I'm as excited and looking
Awesome.
forward to chatting with you.
Yeah.
I deal with allergies, asthma, and atopic dermatitis, commonly referred to as eczema. These are the three most common conditions I deal with on a daily basis. They're different manifestations of the same underlying process, hence that's the thread that connects all three conditions. Allergies, broadly speaking, is a result of exaggerated immune response to otherwise inert stuff like pollen. When you think about it, your body should not be reacting to pollen. It's not going to do any harm. It's not like a virus or a bacteria. But it does in patients with allergies. The end result is a release of a bunch of chemicals and mediators, resulting in symptoms like runny nose, stuffy nose, sneezing, itchy, watery eyes. Asthma is the same process, but happens in the lungs, which leads to symptoms like trouble breathing, wheezing, tightness, and cough. And eczema is when skin is affected by the same inflammatory process, and that leads to rash, itching. My typical patient would be someone with a history of eczema or food allergies as a child, and then developing allergies and asthma later in life. We call this commonly the Atopic March. These are very common. Asthma affects almost 8% of the US population, allergies much more than that, almost 25 to 30%. Eczema affects 15% of the kids and about 7 to 8% of adults. So we're talking tens of millions of patients.
Mm-hmm.
Why are these important? These conditions rarely are life-threatening. We rarely hear about someone dying from an acute asthma attack, but that's about it. But as for the quality of life, they make your life miserable just because of disabling symptoms, leading to work absenteeism or more often presenteeism. They're there at work, but not productive enough due to various factors, fatigue, sedation, side effects from the drugs. And also the healthcare costs can run into tens of billions of dollars every year, especially with asthma.
Mm-hmm. Yeah, I've dealt with asthma and allergies in my entire life, and it's a lot of health visits, a lot of medicine, a lot of preventative factors, and can definitely, affect the quality of life of a few people. So thank you for sharing that today.